today at EHA. I will present a poster regarding trying to identify prognostic factor associated with PFS in patients from the KarMMa-3 study, which is evaluating ide-cel versus standard of care in patients with multiple myeloma in relapse after 2 to 4 prior lines of treatment. So these are 250 patients treated with ide-cel, and the median PFS of these patients are 15.7 months. So we try to identify biomarkers associated with a longer PFS defined by more than the median PFS, and those without long PFS. First of all, it has been already shown that inflammatory cytokines before apheresis is associated with lower response rates. And that first we show that at the day of infusion, the tumor burden as measured by soluble BCMA and also inflammatory cytokines like TNF-alpha or IL-10 are associated with a lower PFS. And what we found also is that the PFS is associated with the tumor burden, soluble BCMA level, but also an inflammatory state at baseline at the moment of lymphodepletion. So a high level of CRP, high level of ferritin, and also high level of beta-2 microglobulin and LDH reflecting the tumor burden. So what we found also is that the PFS is correlated with the level of response. We have a better PFS in patients in reaching CR. And when we look at MRD, we have also a difference between patients reaching MRD and having a longer PFS. PFS 10 to the minus 5 is 87% in patients with long PFS, as compared to 14 in patients with lower PFS. And when we look at MRD 10 to the minus 6, it was also different, almost 70% of patients with long PFS, as compared to 14% of patients with shorter PFS. So what we also found is that the PFS is also correlated with a peak of CAR T-cell expansion, but conversely, it was not. There was no association between the persistence of CAR T-cell and the duration of response. So I think those results shown that to reach a longer PFS, patients have to be in a lower tumor burden without any inflammatory state, and also in a post-infusion, they have to reach a deep response and MRD negativity measured at 6 months, and it is also true in patients with sustained MRD negativity more than 8 months. So the next step for the study is to trying to understand the relationship between CAR T exposure and response and duration of response to better select patients because we need to have biomarkers to identify patients who will have a long PFS as compared to patients who relapse early.